When I hear you upset about the medical, allopathic, etc., I totally understand. You know what? And I don't mean to be upset about that, my friend, but you just can't believe after a while any good spiritual person gets tugged on in their heart when you see baby after baby, child after child, and you start to see what they're using to try to deal with their problems. And yet, understanding health is simplistic, and even the regeneration of tissue is simplistic. We don't have to make a deal out of it where we lose ourselves and then we can't figure it out anymore. We don't have to go there. And it just becomes frustrating because the people that come in here are just all in very bad ways, and most of them from allopathy. And yes, diet, yes this, yes that, but I can tell you, when you treat your problems. A good example was a young lady from the YouTube that came in with psoriasis on the face. Started out as childhood acne, of course, and of course, what do you do in allopathy when you see something on the skin? You suppress it. What do you see when you have lung problems and mucus that you have to expectorate? You suppress it. Well, suppression today is your nightmare from hell tomorrow, is your tumor tomorrow, is all of this, and this is what we have to change. Expectoration is a better word than suppression. Back in my 20s, I wanted to help, to heal, to cure people. I worked as a medical courseman. Wow. Then a nursing assistant, eventually became a registered nurse. Now here's a good RN. As a nurse, I witnessed what was actually going on, and I was horrified. Now this is a high soul here that got in and wanted to help others, and then she got to see the reality, or he got to see the reality of what's going on there. And it is horrifying when you start to look, what? I remember once, I can't remember what floor it was, but had to be the cardiac floor, because I walked up and was watching some heart monitors and talking to the charge nurse. Well, there was a infectious control physician, I guess, up there, and he was kind of a friend of mine, and I've known him for a long time, and I was actually going to go in business with him and open up a health place and everything, believe this or not, but he was bragging to me and the charge nurse of how he foreclosed on an elderly person's home for not paying their bills. Can you imagine being happy about that? I mean, we looked at each other and almost threw up or smacked him. I mean, it's like, what? You did what? For what? Money? You threw old people out of their home? What? Proud of that. But this one lady was in trouble. Her heart kept going down, and she was in trouble. So her main physician came aboard, and we was looking at her chart, and she was on 32 medications. He called every physician that was on her case and discontinued every one of them. Every one of them. And then her symptoms stopped. I mean, I've seen a lot too, guys. It's just amazing. So this nurse I could see what was going on. I remember wanting to whisper to my patients, get out of here before they kill you. And this is the truth. People don't understand that. They're out there in the wilderness out here, and most people have good hearts. Most people are loving people. They just need a chance to be loving people. But every direction, they're slammed down. And this is one of them. I saw unnecessary surgery going on. Boy, did I ever see that. I saw people mistreated. I saw poisons, toxins administered. I was just 20 years old. At 20 years old, this individual had the spiritual insights to recognize that. And that's what I'm saying. You younger people are spiritual souls coming to this planet, and you're waking up quicker. You're seeing things for what's going on, and you're trying to get into a position to help. I love that. And that's what we're trying to create here, a major movement of spirituality, of love, of joy, of happiness, of health and well-being. Change the negative power. And we must be strong to do that, because that negative power will be nipping at your heels. The but, if, I can't, things like that. What I did not know was how to stand up against it. My final straw, where I knew that I could not be part of the illness care industry, was when I was working on an emergency room nurse. Oh my God, working on an emergency room nurse, and a pregnant woman was going in to get a shot of Compazine. I was to give that shot. I had never given Compazine to a pregnant woman, so I went to look it up in the PDR. Oh, this one's going to be good. I've heard of that, but I don't know the PDR. Let's see. It said, hopefully the need will overweigh the risk. Don't sound good to me. Anyway, the woman came in. I asked her what was going on. She said she was a little nauseated. I thought to myself, go home and have a few crackers. Wasn't it into raw back then? But then I thought, okay, this is between the doctor and the patient. Who am I? Just the lowly nurse. You're not just a lonely nurse, sweetheart. I know a lot of people don't realize this, but a lot of RNs have saved a lot of people's butt. Medical doctors giving wrong medications, and I have myself story after story of wrong medications prescribed. Remember, a few years ago, the pharmacists were trying to get the medications in their hands, and that's what you do. You give the job to the experts, and pharmacists are experts more or less with pharmacy. And this is real important, although I'm really sickened with the drug chain, what is it, Walgreens? Did you see that little commercial on TV with Walgreens? And this lady's real sick with mucus and everything, and she's trying to throw greens in the blender and all this and trying to blender up a health drink, but they do it in such a way, it's like, all this trouble just come into Walgreens. We have the chemical for you. I tell you what, that commercial just made me lose all respect for Walgreens. That was unbelievable. Unbelievable. Hey, don't eat those fresh veggies. Don't do those fresh fruits. Don't try to help yourself. Come into our pharmacy. We have chemicals just for your problem. It's easier. Just take them. Just take a pill. Don't have to juice a juice. Take a pill. That's where we're at. Oh, and I think that commercial should be shut down. That's not even right. That's how you silently brainwash people. You know, this is why you have these evil people doing that, and there's nothing more than evil that you have to say about it. Anyway, let's see. I thought to myself, go home. Okay, let's see here. They said they gave it all the time. Okay. So as I am posed, stringent in hand, ready to give her the shot, she said, "Will this hurt my baby?" Well, I told her everything I read. Well, of course, when she had all the information, she made a wise choice to protect her child. Thank God. You know, you did the right thing, sweetheart, no matter what. If it cost you your job or whatever, you did the right thing. This is what's going on here. We could give a little ginger. We could give a lot of little things for nausea. We can clean the lady up. We can help her with her kidneys and her lymph systems, even while she's pregnant. There's so many neat things we can do to help her with these problems. Not give her chemicals that can have dire consequences even for the fetus. Good woman here. But then I, on the other hand, had to go admit that to the patient no longer wanted the medication. So I went and told my head nurse, and she said, oh my. She then came up with a long story for me to tell the doctor. I could not remember the story, so I said to the doctor, she changed her mind. It makes you lie to him, doesn't it? I then watched as the doctor then called back to talk to the patient. Oh my God. Overhearing the patient saying that the nurse told me, on, and then the doctor called the head nurse and demanded to meet with her the next day. When I came to work the next day, my head nurse called me into her office and told me, next time a patient asks you a question, what you need to do is to have the patient talk to the doctor. Yeah. There is so much, you guys, that's going on in hospitals and everything. I get the rant. I understand the rant, sweetheart. I do. Over the last few years, I have been studying to become an herbalist, smart woman. I tell you what, RNs are a shoe-in for this level of thinking. A shoe-in. They've got their education behind them. They just move into understanding detoxification. They can come to our schools. We can help set them up in a business to help others the way they want to. I'm telling you, RNs, I've always thought, is a shoe-in. I'd love to have my whole clinic full of RNs. They really are good people. A lot of them. Now, you also have the RNs that are so narcissistic, and you know this too, my friend, that they're just so above everybody. And Kim, no big deal. You got that kind of RN too, unfortunately. These are the better RNs. These are RNs. Like I said, we have a Holistic Nurses Association in Sarasota. I'm sure they're 300 or 400 strong right now. It's a lot of RNs looking for something to do to help people. They're in the job to help people. Well, this is a shoe-in because this is the highest level of healing, and we need them because they're caregivers. They're love people. They can work with people in their detoxification. It has taken me all these years to find what I was looking for. I love herbs. Yoo-hoo! That's why. Definitely God's gift to us. And this is why I called my company God's Herbs in the beginning, because I want people to understand God is responsible for putting these beauties on the planet, and they are our nectar. They are our remedies. They'll help us where the hybrid foods can't. So, absolutely. I have several family members that believe medical doctors know best about health. No offense. They don't even go to school for that. So how would they understand health when they don't go to school for that? That's what people do. I don't understand. That's how good brainwashing that the World Bank does. Because you have to call it World Bank because that's Rockefeller's. I mean, you just got to understand when you look at them. And when you remember I told you 60 Minutes did a piece on medical doctors that kill people or hurt people too much in one state and move out to another state. How does that state protect their people from these guys? And they went to the head of the AMA at the time, and he said, "That buyer beware." Not patient, not poor suffering soul. That buyer beware. That's how they think in monetary form. Well, let's say the AMA, they're walking on a razor blade. They're lucky they're not yanked into court. The whole modality, American Medical Association, and sued the pants off of them for all that their tricks and what they've done and the level of killing that this field does. This modality has to be changed. The day of the AMA is just about over. We have to have radical changes. The word to the AMA, get homeopathic. Get something that doesn't hurt people. Wake up to truth and reality and the basics of how the body works, and get rid of these old antiquated theories that you keep pulling around. Medical doctors, please become homeopaths. All medical doctors should stop and learn and start practicing homeopathy. Not only will the deaths stop, but the symptoms will go away, and you'll start learning the connection to naturopathy, which is the curative side of all the health modalities, the only curative true modality out there, true naturopathy. Naturopathic medicine is disgusting to me. It's an oxymoron. And you got Bastier and Southwest teaching this medical consciousness, so where they took the medical and cloned it into naturopathy. And Dr. Jensen always hated that. I always was getting calls to see if from these top guys, if I could get Dr. Jensen to get on their board and all this, and it's like, he didn't want it and I didn't want it. And the reason was they're teaching the wrong things. And so I get a lot of students from some of these naturopathic schools sitting here learning and trying to get some clinicals, and they don't know squat after 5 years. If I can't teach you after 5 days how to cure anything, I feel I failed in my mission. Medical doctors can't cure anything. That's not their job, that's not their modality, and man has to just wake up to that medical doctors aren't in the field to cure. They might use those words that they're looking for these things, but that's just hype because they know they can't cure, treating symptoms. I'm in naturopathic medicine school, and our profession is becoming, hydrolyzed with allopathic medicine. No kidding. Doesn't that make you mad? That makes me mad. That the Bastier and Southwest, these are medical doctors. All right, so I don't know what to say. You're hit it right on here. They're infusing us with this type of consciousness. How do you ever find wellness if there's with all those avenues shut down? And that's the goal of the World Bank and this whole 9 yards. The feelers that is encompassed. Oh no, these guys are very smart. Remember Rockefellers? These guys are very smart, and so they've mafiaized. They've set this up. So yes. Sad, sweetheart. Take what you can out of the school. Take this. Understand this is taking what you're learning a little higher. Get your A and P. Get how to pronounce these words. Well, they probably won't be that long. Get how to do all that, and then know what to be true. Go after it the right way, and you'll be a very successful naturopath. And then you can work with us to change naturopathic consciousness, because there's medicine and naturopathy are oxymorons. Totally. We have nothing to do with medicine. And if we get out, we have everything to do with health and vitality and spirituality. We have nothing to do with the treatment of diseases. And as soon as naturopaths learn that, they'll be so better off. The deficiency syndrome, they'd be so much better off to drop that. I mean, so many naturopathic medicine graduates in here didn't know how to cure crap. You go to school for 5 years, you better get out of that school to cure any and everything you come in contact with. If you're not, my cliche is, why did you go to school for? As soon to be osteopathic school applicant, cool beans, osteopathic school. Yeah, you'll be able to help them out pretty good there. I have a lot of good osteopathic friends. A lot of good osteopathic friends. Dr. Van Kyle out of Pennsylvania, good friend of mine, good old farm boy, hair down to his lower back. I mean, this guy sees more patients than Carter's got pills. But he's a good guy, he raises his own herbs and everything else. Osteopathy needs to come back to its more of its roots and get more natural involved and influence the allopaths to that way too. Instead of the allopaths influencing osteopathy, we need osteopathy to influence allopathy. I get that right? Please don't judge me. Oh, I don't at all. I'm glad you're in osteopathy. Not at all. I think that you're there to make a difference. And a lot of great osteopaths out there making a difference. You know, Willie's got a good friend. We have a good friend up there, Dr. Streeter, up in Shipshewana. I mean, there's a lot of good osteopaths there that have taken on that natural side. I've just got a lot of respect. I have respect for all levels. It's when your level starts hurting too many people and you get lost in that and you get narcissistic about that's a problem. And that's the only thing about that. But we need all levels. We need allopathy. Don't get me wrong. We need surgeons. You get in a car accident, you need surgery. We need a good emergency medicine. But we also need the proper health care. We need to separate that which is emergency and trauma from that which is our daily lives. Even though we must understand in trauma cases how we pull them out of that and repair tissue at a much more rapid rate. Understanding health and vitality helps us to reach into emergency medicine and do a much better job than we're doing. And also with surgery, we must also understand naturopathy is the core healing modality, I've said this before, of all life. And all life springs from that. All these modalities, osteopathy, allopathy, homeopathy, all these viable sciences definitely spring out of nature. Because if you understand the core issue of chemistry and physics, you will understand how we repair tissue faster, how we can help people in trauma cases better, burns patients without all the suffering. I mean, there's a high level here, so enjoy osteopathy, absolutely. I'm not judging, good man, I'm for you. The herbalist I have been seeing says my insulin levels are shot and I should eat no more than 2 pieces of fruit a day. I love this guy. Now listen to this. I love these people. Where do they come from? Where do they come from? Here's an herbalist I have been seeing says my insulin levels are shot. That's kind of a cranky way to say it. Imagine a medical doctor saying, well, your insulin levels were shot and you're screwed. I mean, I don't think so. Pardon my French. You guys get me carried away. All right, so this herbalist says that her insulin levels are shot and she should have no more than 2 pieces of fruit, which is not insulin dependent at all, a day, and that fasting my body is wrong, that I need the nourishment and I should be eating protein every 3 hours. Bad herbalist. Bad herbalist. And he should stay with, or she, to just herbology. And she probably doesn't know how herbs really work. No offense, but sounds like that's what's going on here. I respect this woman, so it is a woman. She was my remedial massage teacher. Well, she doesn't know enough, honey, because what she's saying here is not health at all. She hasn't got a clue about health. She was maybe a good massage therapist, but she has no clue about health. Just because you're a massage therapist doesn't mean squat about you know anything about health. And the same thing with nutritionists, the same thing with chiropractors, the same thing with medical doctors. What field studies chemistry, physics, and health the most? Naturopathy, thank you. That's what our whole field is about. The The only time a medical doctor has a cure is when they step over and say, oh, I like what you guys are doing. Well, absolutely, because we're in the actual health side of it. But we've been slandered so much through the years that people are afraid of herbs. Can you imagine making people afraid of God's herbs? I mean, I find that karmatic right there. So, don't be afraid of what God, nature is you. You can't separate your human body from this world, and don't try. Man's trying. And that's the trouble, again, with medical science. It's not a science. Nature is the science. And we just don't get that. These are boys playing with toxins and toxic chemicals and hurting animals and people. For someday to find a cure that there'll never be a cure because it's the wrong thinking. People, notice they give antibiotics for every single thing? Everything, because they don't have anything. That's, if I was a medical doctor, I'd be so frustrated with the lack of tools that I would have to give someone well. We'll just give them antibiotics. I'll give them more antibiotics. I mean, the ridiculousness of that thinking. Just amazing. I was talking to a medical doctor over the weekend of another young man, just sad case, real sad case. And this medical doctor had already started him on a type of insurer, even though the mother was vehemently opposed to it because she's already been through all that. And I told the medical doctor if she wasn't careful, she was going to give this young man pneumonia, which ended up doing. And then if they treat it for pneumococcus with antibiotics, which is just a mucus condition, then they could, this child is so advanced in his problem, they could go ahead and terminate this little boy's life. And I don't know how much she appreciated that, but she needed to know that because she's going to see that happen if she's not careful. I would say in the 21st century, if a medical doctor doesn't understand the mucosa and the mucosic response called mucus and all this, what the hell is he doing as a doctor? This is way past the time. This kind of information was presented back in the 1900s. So you can see over 100 years here, and they still don't get it. The problem is most people's lymph system isn't going anywhere fast. Kidneys aren't filtering. So where their blood and a blood dump's going to dump itself into the lymph anyway, just to clean itself. So it's the lymph system that bears the brunt. This is why I like hair analysis over blood or urine, because very inaccurate at determining these heavy metal levels, obviously, because you have a lymph system 3/4 the size of the blood. Actually, 3 times more than the blood. So you're going to have a lot of waste in the lymph system. And that's the one to keep clean, and then it'll clean you. It'll protect you and clean you better. The problem isn't with your immune system, which is your lymph system. It's the problem with the lack of filtration through the kidneys controlled by the adrenals. And therefore, all this sewage backs up, including anything that's ingested, is not going to be able to be carried out of the body. The blood doesn't do the cleaning. You can't, the medical doctors think the blood does everything, and I find that stupid thinking. Stupid. There's no way. You don't see it in life. Your water pipes is not your sewer pipes too. I want to show you, this is what used to get me. It still gets me. This is Vegetarian Times. This is an old magazine, been around a long time. Associated, of course, with those more in the natural health field. And it's funny, if you look at all these magazines, for some reason they just feel like they have to go to medical doctors to ask them their expertise advice. I have to roll with that. It has made me sick all my life, because these two people don't go to naturopaths. And of course, the state of naturopathy today is disgusting. I agree, but still, you would go more to someone in the field. You just don't go outside of the field. And this idea of getting a medical doctor on board in holistic medicine is scary, because I'm telling you, unless they take on that consciousness, they still have that old treatment-based thinking and disease concepts and everything else. And I think it's been unfair that they turn to medical doctors for their opinions in natural health. It used to really upset me, to tell you the truth. And here's a good case in point. Here's an article. Let's see, this is based upon some kind of dandruff. And this article, let's see who wrote this article. He's a medical doctor. I better not say any names. This guy praises sulfur. This guy praises sulfur as it cleans the dandruff off the head and blah, 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 blah. Sulfur has antifungal properties. Bull crap. That is a lie. Sulfur does not have antifungal properties. You see the opposite with sulfur involvement, as I've been talking to you about. This guy is way off beat, and yet he wrote an article in Vegetarian Times. You should have sulfur. It cleans your symptoms. Yeah, it cleans them all right. It suppresses them. It suppresses your lymph system. And that's what we've seen in the eyes. This is what we see in people's symptoms. And don't get trapped with these kind of medical doctors that haven't got a clue about truth. And that used to really upset me because they give misinformation. The misinformation gets out there. People get confused. And what we have is a confused society in natural health because of, back to the AMA again. Either stay or go. That's what I say to them. No offense, but, you know, sorry guys, you just can't keep giving out misinformation there. And people are suffering from sulfur involvement from you guys from years ago treating with sulfur drugs. And the world of mess we clean up. I tell you, you'll see that, all you great healers on the YouTube and stuff. We are constantly cleaning up medical doctors' messes. And it's time they get with it. People are hurting so bad, it just makes you want to cry when you see what's going on. And when people wake up to the truth, shock of what's really going on out there. Diagnosed with diabetes and put on metformin, and yet the doctor says I do not need to keep an eye on my blood sugar. Yeah, don't. Well, that's unusual because really most doctors says we'll just watch it. So I know, you know, it's very common for a medical doctor because he sees everybody on the 15-minute or less. Less than most times here. How's he going to know you and take care of you? Yeah, reality is that you're stuck on medications and you'll be on them the rest of your life because they're not going to take you off of them. I mean, there's some good medical doctors that maybe watch and do that, so forgive me, but what I see here, people come in here, they've been on medications for years and didn't need them, and the medical doctor didn't do a thing about it. It's like, that's not good. You have to take responsibility because as a practitioner, I'm going to have you on an herbal program, but at a certain point, I'm going to get you off of most of them and go on. If you need something, we're going to keep going. We're going to work on that or not. You know, we're going to change things around. We're going to deal with that. The idea is that your food be your medicine and your medicine be your food. The sad thing that I see in medical treatment is when it comes to burns. This is one of the worst areas besides oncology that allopathy is involved in. First of all, there should be a tub of aloe vera, fresh aloe vera. It's all over the place. Everybody should be growing aloe anyway. I have tons of it in my house. But bathe in that. Get some burdock leaves. My old friend John Kime, Amish land, loves burdock leaves. Showed me 2 children that was both burned with gas, and I've talked to you about that one before, where the non-Amish boy they were both burned severely. As a matter of fact, the Amish boy's skin just fell down his arm over his wrist. And I saw the difference. I've always known this anyway, but I've seen the difference between the allopathic treatment and the not. This Amish guy used burdock leaves wrapped around, of course, and then some aloe packs and different herbs and stuff. Well, I was at his place in Ohio when he was in Ohio, and I got to meet both boys. And I can tell you that the boy that went allopathically was mutated. He looked horrible. But the boy that treated with the burdock leaves and aloe, you could hardly see any differences up there. My sister's young son, when he was a young man, he was 3 or 4 years old, I suppose, maybe a little older, maybe 5, but he spilled a hot coffee pot down his face and down his chest. Well, when she was at the hospital, they were rubbing cream on, and my sister happened to ask them about what's this cream? She said, well, it's an aloe-based cream. Well, I had talked to her about aloe vera when she called me upset about her son, and I said, you need to go get some fresh aloe vera plants. So she brought her boy home, and she did just that. She went out and got fresh aloe vera plants, and he ended up with one little bitty scar, I think, under his chin or on his chest, and it was when the dog jumped up and scratched him. Dr. Morse, I just watched Dr. Oz, and he had on a guy who is telling women who have big bellies to eat a mostly protein diet with grains and on ice cream for dessert. And Dr. Oz allowed that. You see, this is where you get into medical doctors who straddle the fence. I'm sure why they don't get cut in the groin, you know. This is another straddler of the fence. Can't let loose of the medical thinking. This is the guy that took 12 people, was it, into a zoo and made them eat all raw, and look what happened? And he allows somebody to come on and talk about high proteins on his diet there. It just shows you, you know, I mean, I'm not doubting him. I really appreciate his efforts out there to get people. But just remember, these guys don't have the answers they need. They're opening the doors into natural health. And of course, when you open those doors, a lot of people go crazy, yummy, 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 and I think Dr. Oz is one of those. You know, he finds everything fascinating in a world much different than his education was. So I applaud him for that, for sure. But some of the stuff, he's got to step back and realize that it just isn't true. And that, and you also just got to remember when you watch programs like this that most of what you're going to hear probably is half-truths, and some of it not true at all, and then some good truths. So just remember that and just have to filter through that. You were smart enough to catch that. See that? That poor lady who goes on a high-protein diet probably will, too, trusting in his concepts. But that's a bad concept. High-protein anything, very bad concept. All your great naturopathic physicians, homeopathic physicians of the 1900s, 20th centuries, nixay on protein A. Bad consciousness, bad move. I unfortunately submitted to 3 ganglion blocks and 1 barrier block. Oh man, very painful and made me worse. The neurotoxins really did a number on. See, this is the play of the medical field. These are like children. These medical doctors are like little children that have the right to do anything they want with people. Oh, you mean I get to experiment all I want? Sends me out to nowhere land. So they say, you got a lot of passion. I got a lot of passion because a lot of people are hurting and suffering because of what the AMA, because of how we did with the American dietetics. We're all hurting. So yeah. We got to change things, and sooner than later. And that's what I love about you guys. It's all coming sooner than later. Then thank all of you for helping all your friends and all your people, all you Facebook guys, all of you guys all around the world. Thumbs up. Thumbs up. We're going to fix this planet. She had neurotoxicity from the anesthesia from the tumor removal. Interesting how when you go back you can remember these things, especially when we start looking at the negative effects of anesthesia on the nervous system of the human body and what happens when we shut down the nervous system to things. Remember the thing on type 1, the neural system shut down on the beta cells. You can be going to the beta cells. Nothing wrong with the pancreas. What's going on here? Oh, did we not think? So, you know, this, and consciousness is like that. And I don't blame anything. I tell you this. In the day past, okay, but we know too much right now to say that let the medical profession get away with this. We know way too much, and they know too much. It's not a day we can claim, oh, I didn't know that happened anymore. We know. I'm totally on board with the alkaline versus acid part, but chemotherapy saved my brother. Oh, did it. And every year more and more cancer patients get well due to treatment. Boy, you got your head where it doesn't shine. I'll just tell you that, Bobby McGee. You have no clue to what you're talking about. If your brother survived it, good. There are 6% of the people that take it survive it. How do you explain 94% that die? Oh, but we'll keep going and get a better therapy, and in time, that number could be 80% that die instead of 94%. Get out of here. That's crazy. This must be an oncology nurse, Because let me tell you, you're barking down the wrong tree here, dear one. This is insane. This is criminal. And you might have 2 or 3 survive it. If your brother survived that, we could have cleaned him up like that. There's a big difference between the level that this is at. Now, at least 90% of the people here that go on these diets that come in here with cancer and they go after their health issues walk out without it. So 94% don't walk out of it when they do chemo. Explain that one. So you don't go there with me with the chemo because you have no clue. I see thousands and thousands of people worldwide, and I can tell you that the bulk of the people are not going to be on your side of the fence, dear. Not at all. You have a very minority that survives this to 5 years. But just wait. Your brother did nothing to fix the problem, and just wait to the future. That's why he needs to get a hold of this now and get his body's lymph system cleaned up, and then he probably will never have to deal with it. But you've never done anything, and you've killed billions of cells. It's just a matter of time. It's just a matter of time. You can't go any way with me with chemotherapy, dear, because that's been my specialty for 40 years, and our reputation precedes us with that. In Norway, number of survivors have increased dramatically. Oh, really? 2 out of 3 people diagnosed with cancer get well now. Oh, do they really? With chemo? I doubt it very seriously. I think you're smoking something in the back room. What the hell is wrong with you? The doctors are evil people. They are lifesavers. Yeah, you definitely need to just stay with allopathy and leave this website because you have no clue. Your statements are bogus. Your statements hold no water. I don't know who you are, what game you're playing here, but you have no clue. You're making statements that are very untrue. I've spent a lot of years in emergency medicine, dear one. I know well allopathy, and my ex-wife is a cardiac nurse. I know well about this. You don't. And this is bull. Medical doctors are not evil. They're just unaware and ignorant. And those that become aware and still kill people with this, now they're evildoers. Because you don't do that. That's not how God intended the earth to be. And your life is too much allopathy. Well, you go out and enjoy it. Go ahead. The people on this site already have been there, and they're now leaving there. So that statement you're making is not going to convince anyone. Not at all. Because we have tens of thousands of people worldwide that are suffering and been to all the best doctors in the world. That statement you made is so ridiculous, I can't even believe you made that. And especially on this site. That is ridiculous. You haven't had enough experience with the allopath, so I suggest you stay there for a while. Enjoy that side of life, and we'll enjoy our side of life. And then when you get awakened, you'll see the difference. We have so much evidence exposing allopathic ridiculousness that they really wouldn't want to take one of us to court and really appreciate what that would give them, because some of what they're doing, even children know better. Now, some of you might take offense at that, and I hope not, because you have to sit in this office and see what we see and cry how we cry. When we see all these people, you've been
what's actually happening.
What's actually happening?
They've actually done to these people.
Exactly. What the AMA's actually done to all these people. You've watched this with me. You've been with me a couple of years, and you've seen all this. And it's just you just have to see this firsthand. You have to see the suffering, and that pretty much it does something to you.
It's sad when these folks come here as last resort.
Yeah,
I mean, very last.
It is. It's sad. You see them all week this last week.
Yep.
Coming in here in their stretchers and their I mean, it's just sad stuff. I hate that. We've always cleaned up, and I know you go, don't be offended with this, but we've always cleaned up medical doctors' messes, and then no one's ever appreciated that. But that you healers you'll be doing nothing but cleaning up medical doctors' messes, and from the suppression of the lymph systems to all the radical surgeries. But again, there's also the good side to that. I'm going to say that. Cancer is a money-making machine. No kidding, brother. I'm telling you, look at so slick now. You see all the pink ribbons. Look at the power that they've gotten to get people to donate and the sympathy that they've generated for breast cancer. Now, the problem with that is they still make people full of fear. They rake in money for research. It goes in the same people's pockets that don't have they're never going to find this miraculous cure because it already exists. It's just simply reversing how you created it. That's all cancer is reversing how you created it. It's that simple. And so I hope that we change these things, because my passion is with those that wake up with a tumor and they go to the medical doctors. That's where the mistake is. You don't go to them first. You go to them last, because I guarantee you, if I can't, or one of those healers that are at our levels can't help you, then go allopathically. No question. You never go to them first. That's the problem with our society. We're going to the allopathics first. That's where you get hurt. You want to go to naturopathic, homeopathic, or the natural health people first. And if we can't get you at this level, you're in deep trouble. That's all I got to tell you. If you can't overcome your problems doing this, you're in serious trouble, man. That's all I can tell you, because you're at the top of the mountain in healing. There is no magic elixir floating around out there. And none of you should ever feel that you need some kind of medical degree or medical understanding to help people be healthy. The simplicity of it all is shameful in the sight of intellectualism. The simplicity of getting well should be accepted with open arms, instead of trying to hang on to academics and that, because when you do, we see this all the time. It's difficult when people come and they ask me, what about this machine? What about that thing? What about this? The mind comes in and everybody's trying to treat cancer or treat something that's hurting them bad, and how can we get in and kill it? And these are all illusionary concepts that keep you in that kind of thinking and keep you wrapped up in that. Even when you see factors in your blood work going up and down, enzymes and antigens and things like this, you're always going to have a movement of this. Always know, though, that when you're on a raw food diet, you are at the top of the diet chain with the other animals. We are way out in left field, and eating foods that are not even harmonious to us, creating sewage in our bowels that make us stink to high heaven, acidifying our body so bad that we're mutating our cells at an alarming rate. I mean, it's still sucking down milk products way after you're weaned, and from other animals. I mean, it's not a pretty picture of what the state of human existence right now, and the level of their dietary habits. Gross, to say the very least. So we have to get back